These are inappropriate and destructive policies. I'm sort of disgusted and dismayed at the state of things.
Hello and welcome. You are watching Lockdown TV from UnHerd. Well, we've been talking a lot about herd immunity, about different coronavirus strategies, and one name that comes up a lot in this discussion is Dr. Scott Atlas. He joins us now down the line from the White House in Washington. Dr. Atlas, hi.
Thanks for having me. Nice to be here.
So you are a special advisor to the president and a member of the coronavirus task force. Who at the moment is making the decisions about White House policy on coronavirus?
The president. It's always been that way.
And how does the advice get to him? Are you now the kind of conduit of that collective advice? How do the different voices on the coronavirus task force combine to provide advice to the president?
Well, there are recommendations from a lot of places to the president. I am a person who has recommendations to the president. Various other recommendations and discussions are heard from the task force. He also listens to people from outside the government, outside the task force, inside the government. So there's a variety of people, which is appropriate because it's a complicated situation. And it's not just about one facet. It's in fact that's why I was brought in here, because my background is I'm a healthcare policy person, and I have a background in medical science. But my role really is to translate medical science into public policy. That's very different from being an epidemiologist or a virologist with a single sort of limited scope or limited view on things.
Then we have people like Dr. Fauci, who is also a public health policy guy. I mean, how should people outside interpret both you and him being advisors to the president and yet with apparently such different views?
Well, I don't speak for Dr. Fauci at all. He's just one person on the task force. There's several people on the task force, and his background is virology, immunology, infectious disease. That's his approach. It's a very different background. It's a more limited approach. And, I don't speak for him and I don't speak for anybody. I speak for the interpretation of the data and the subsequent evolution of that data into the best public policy advice that I can give the President of the United States.
So there was a story in the Financial Times, I think a couple of days ago, saying that you are now advocating a herd immunity policy and that is now the official position of the White House. Is that the case?
No, it's a repeated, distortion, lie, whatever word you want to say. Frankly, I didn't really read the piece. I used to have time to read the Financial Times, but I don't have much time these days. But in any event, there's some kind of a, strange distortion, a persistent sort of attempt to characterize my advice and the policy of the White House and the policy of other people into something that some people have called a herd immunity strategy, quote unquote. And what they mean by that is survival of the fittest, let the infection spread through the community, and then develop a population immunity. That's never been the policy that I've advised. That's never been the policy that's ever even been discussed inside the White House, not even for a single minute. And that's never been the policy of the President of the United States or anybody else here. So I have to say that I've said that many, many times. I've explicitly and precisely in these words and even stronger words denied that is a policy or a recommendation of me Yet it persists like so many other things, hence the term that the president is fond of using called fake news, because it's an accurate term.
I guess I have to ask, what is your advice to the president if it's not that?
Policy, my advice is exactly this. It's a three-pronged strategy. Number one, aggressive protection of high-risk individuals and the vulnerable, typically elderly and those with comorbidities. Number two, allocate resources so that we prevent hospital overcrowding so that people can be treated for this virus, and also get the other serious medical care that is needed. And number three, open schools, societies, and businesses, because keeping them closed is enormously harmful. In fact, it kills people. That's the strategy. That is very different from just saying, open the barn door, as we say in the United States, and let an infection spread through the community. That's never been the policy. I've never recommended that. But what I have done, and what everyone else who understands basic immunology is understand that population immunity is a biological phenomenon that occurs. It's sort of like, if you're building something in your basement, it's down on the ground because gravity puts it there. It's simply, it's not a strategy to say that herd immunity exists. Herd immunity is obtained when a certain percentage of the population becomes resistant or immune to an infection, whether that is by getting infected or getting a vaccine or a combination of both. In fact, if you don't believe that herd immunity exists as a pathway to block, as a way to block the pathways to the vulnerable in an infection, then you would never really advocate or believe in giving widespread vaccination. That's the whole point of it.
Is it fair to say, though, that since your arrival at the White House, the policy has shifted in that direction? I mean, is the three-pronged strategy you describe, which is based on protecting the vulnerable and placing as much emphasis as possible on opening society, is that now officially the White House policy to coronavirus?
It is the White House policy to coronavirus, but interestingly, it always was. Well, the president started this whole sort of observation with something that I think was overlooked by most people in the world and most governors and states in the United States. When he said in the third week of March, the cure cannot be worse than the problem. The cure cannot be worse than the disease. And that is a very common sense, very smart, wise statement, particularly since we've learned how enormously harmful the lockdowns and the restrictions of individuals and families and school openings have been on society. In April, the White House released a formal Reopening Up America, or Opening Up America document. And in that document, it was explicitly stated that the White House at the time, I didn't come till the end of July, in April, it was stated extreme protection of the vulnerable, opening up schools and businesses safely, and preventing hospital overcrowding. And there are dozens of statements by the president since then, up to even a couple of weeks ago, saying explicitly we're going to aggressively protect the vulnerable and open up society. Now, that is not necessarily the strategy that much of the world believes in, or at least has until this point. And we know that because we've seen societies repeatedly lock down, use prolonged lockdowns, use terms like we must hunker down, we must restrict movements, we must keep schools from opening, we must keep colleges from opening, we must test, and restrict businesses and restrict restaurants to 25% occupancy, et cetera, as you know. That is not his policy.
Is it the case then that the first round of lockdowns in the spring, you now and the president now believes were a mistake and that you wish they hadn't happened? Or do you think that they were necessary but you don't want to see them happen again?
I don't think they were a mistake. I think we can use the retrospective eye on things, but in reality, when this virus first was noticed, There were a lot of things that were not known. In fact, very little was known. The estimated case fatality rate was 3 or 4%. It was 3.4%. That was a horrendous number. There were all kinds of things that needed to be done. Resources were not available. No one was really prepared for something like this. It was blindsiding the entire Western world. So this whole concept of the 15-day or the 30-day shutdown was done out of the information we had at hand, and also this concept of so-called flattening the curve. And I think everyone by now knows flattening the curve, although many have forgotten. Flattening the curve was intended to prevent hospital overcrowding and also use that time to help develop and produce personal protective equipment, accelerate drug development, mobilize resources for hospital capacity, personnel shifts, all kinds of things.
Were you in favor of those at the time on that basis?
I thought it was reasonable to, the immediate short-term shutdown was a reasonable policy. I mean, the models that were completely wrong in retrospect and worst case scenarios were frightening. At the time, I think everyone sort of bought into this initial short-term shutdown. What happened, though, as you know, and as everyone who's ever seen any of your tapes has known, is that became a prolonged, ill thought out and harmful policy that has stretched into months and months in various degrees. That is the wrong policy. That I am completely opposed to. And that is a policy that the president thought was wrong even as early as March, when, of course, that's about when I thought it was wrong, too.
So let's dig in a little bit to what you would actually like to see happen from now on. So the idea is to protect those people who are at most risk from the disease and as much as possible allow the rest of society to open up. At least here in the UK, we've had a similar debate, and it's met with the following objections. So I wonder how you respond to them. The first is people say that immunity from COVID-19 is not a long-term effect. So it will taper off after a period. So hopes of reaching a kind of widespread herd immunity are ill-founded. What do you say to that?
I just think that the viewers have to understand that this is not like we lock down and hope for herd immunity, or we hope for herd immunity. That's not the issue. The issue is we must open up because we're killing people. In the United States, and I know you didn't ask me this, but I think it's important to say right up front. These are just US numbers, and then I'll talk about something else. In the US, it was just the data came out a few days ago that 46% of the 6 most common cancers were not diagnosed during this shutdown. Okay, these people, the cancers are there. They didn't disappear. These are people that will present to the hospital or to their doctor with more later stage disease, more widespread disease. Many of these people will die. 650,000 Americans are on chemotherapy. Half of them didn't come in for their chemo because they were afraid. 2/3 of screenings for cancer were not done. Half of childhood immunizations did not get done. 85% of living organ transplants did not get done. And then we see the other harms, 200,000 cases plus of child abuse in the United States during the 2 months of spring school closures were not reported because schools are the #1 agency where child abuse is noticed. We have 1 out of 4 American young adults, college-age adults, 25% thought of killing themselves in the month of June due to the lockdown. This is the topic this is why you open up. That is the reason to open up. The reason a secondary gain might be herd immunity or population immunity, but the reason to open up is what I've articulated. And I think I want to say one more thing, which again is never talked about in the United States. It may be, and I think it is, by people like Sinatra Gupta in the UK, and that is that all of these harms are massive for the working class and the lower socioeconomic groups. The people who are upper class, the people who are working and can work from home like you're doing right now, the people who can sip their latte and complain that their children are underfoot or they have to come up with some extra money to hire a tutor privately, These are people who are not impacted by the lockdowns. But most people must go to work. Most people have no money to hire tutors. Most people are paralyzed when their children are not in school. That's the reason to open up. There are many things not known about this virus. There are many things not known about every single infectious disease known to man, by the way. Now, immunity and resistance to infection and susceptibility to infection are all related. We don't know how long someone's immunity lasts to this, but this is a coronavirus. This is not a completely novel family. It's in a family of viruses called coronaviruses. And coronaviruses are in the basic immunology textbooks. And coronavirus exposure typically has a year or even a few years of immunity. So we can make a first guess that is a good chance that will happen. Second of all, yes, we know antibodies disappear, and there are several studies in the literature on this virus that show that antibodies are transient, but that's true for every infection. That's a typical scenario. That's not a cause for panic. Why? Because we know that there is resistance to infection, or should I say, protection from infection, protection from severe disease. This seems to be coming out in the literature on this disease too, that is not necessarily due to purely antibodies. There are other components of an immune system, and it's still being worked out in the literature, but suffice it to say this: do we know that people have immunity or protection? You don't have to be a scientist to understand that when you have hundreds of millions of cases. The most recent estimate I saw from John Ioannidis, a Stanford epidemiologist, is that about 10% of the world's population has had this infection. And that means 780 million people. And do you know how many cases of reinfection there are? At the most 5. And it used to be 3 until 2 more came out this week. In the world, 3 to 5 cases of reinfection out of hundreds of millions of people who've had this. So to think that we must panic because we don't know if people are immune. Well, I mean, you don't need to be a PhD molecular biologist to understand the common sense and the basic immunology that we know for decades and decades is that it is not true that there's no immunity from this. That would be a bizarre conclusion to make, given even what we know.
I just want to come back on actually something you said a bit earlier, which is detailing all of these terrible impacts, secondary impacts of lockdowns. I think what opponents would say to that is that a lot of these things are essentially impacts of the virus. If the general public is frightened, they're not going to come into hospital. It's not that someone has said don't come into hospital, it's that they feel afraid.
Yes, that's a good question, but I think that there's an answer to that, which is this is one of the biggest failures of the voices of public health in the United States and in the world, is that they instilled fear. They specifically instilled fear with their proclamations, their statements that, oh, we don't know this, we don't know that, as if we knew nothing about immunology, as if we knew nothing about viral infections, as if we knew nothing about coronaviruses. And the models that were put forth that were worst case scenario models that were just hideously wrong. And the media that has hyped up these rare exceptions like multisystem inflammation in children, even though we know the overwhelming evidence is that this disease is not high risk for children. It's absolutely not high risk for children. So all of the sort of hyperbole, the sensationalizing, and the failure of public health officials to articulate what we know instead of what we don't know has instilled fear. And I agree with you, it's the fear, but the fear is due to what was said by the so-called experts, by the media, and by the really a failure to understand that they were instilling fear, or failure to care they were instilling fear. And we see it today, every single day.
What role do you think the president has had in this, though? You know, I mean, he has been, in the beginning, he was playing it down, then he was suddenly taking it very seriously. He was not wearing a mask, and then he suddenly wore a mask. He devolved it to the governors, or then he told them what to say, and then he got the disease. Do you really think that the president has helped assuage fears with a consistent and reliable attitude to this?
Well, I think what the president tried to do was articulate the problems with this single vision, misguided policy from the beginning, as I said. And he's clearly had a consistent statement, multiple statements over months about what he thought the policy was. We live in a federalist system here. This is not an authoritarian it's not supposed to be a very super powerful centralized government here. The states are run by governors. It is not nothing is really supposed to be done by federal mandate here, or at least very little is. And I think it was appropriate what the president did to say, listen, actually, we could see it right now from my last question, really, which is it's appropriate for a public leader to try to calm people down, to have an articulated, all-encompassing vision of what should be done. It's not appropriate to panic like so many leaders did, like so many, even some have admitted that they panicked, whether in the United States as governors or in Europe and elsewhere. It's not appropriate. It's never appropriate to have fear. There is no such thing as a government leader who's competent, who instills fear in the public. So no, I disagree that the president was wrong in doing in trying to allay fears.
I'd just like to move on to the second kind of big objection to the policy you outlined, which is, and it's been talked about a lot here, which is that it sounds good to just defend or protect people who are vulnerable or allow them to protect themselves and let everyone else get on with their lives, but practically it's impossible. So you have multi-generational families where grandparents live with grandkids. You have schools that are obviously mix everybody up into different households. You have carers who need to look after elderly people. Do you feel like you have a detailed plan for how you could achieve protection of people with letting other people get on with their lives?
And there's different levels of this. The first is to put forward the guidelines. And I think our society has learned. No one knew what social distancing meant. No one knew really, even though we were supposed to do that for people who were sick with the flu, avoid symptomatic people and be careful around elderly people. But that really was never had the microscope like this. So that was a foreign concept, and we now understand that. But there are more specific measures. And what the United States has done, tried to do, and it's imperfect, of course, is focus on first the nursing home. So we have shipped every single nursing home point of care rapid testing. We need to test the people who enter the nursing homes because that's how the infections get in. So we have mandated weekly testing of every staff who enters a nursing home, but every time there's community increase, whether it's by clinical criteria of people going to the emergency rooms or testing, either one, we recommend going up to 2 times a week, 3 times a week, 4 times a week for staffing. We have hooked up our nursing homes with infection control mentoring programs with hospitals because nursing homes don't know how to do that like hospitals do. We have incorporated surge testing into nursing homes. We have sent tens of millions of tests to senior centers where certain people don't live, but seniors frequent 2 times a week, 3 times a week. We have an alert system that we've tried to do in communities where seniors with high comorbidities live because everybody over 65 in the US has government insurance. So yes, there are specific measures we've taken, but it's difficult.
So I think you could see how that would work just about with a nursing home if they had the tests and if they had the capacity. But if you're a grandmother, a vulnerable grandmother living with a student who is either at high school or college, coming in and out every day with friends, how can you possibly protect that elderly person?
Okay, well, we can do our best. We cannot guarantee that we can protect everybody. There's no such thing as no risk in life, but not to minimize it. We've had 200,000 people die here. It's very serious and tragic. And I know people who have died, and I understand that. But we have to educate people. We have sensitized everyone to making sure. I think you would have to have not been living on this planet to not understand social distancing, guidelines for hygiene. If you're going to be in close proximity to someone who's high risk, you might want to wear a mask. There's all kinds of things to do, and we have incorporated that. We have also done a lot of monitoring of communities. We have, like I say, targeted where the seniors live, meaning non-residential, but in their communities, because in the U.S., Senior citizens typically have a social life where they interact with others in these community centers. We have shipped a lot of testing to there, tens of millions of state-of-the-art point-of-care testing. We're not just sitting here doing nothing. On the other hand, there is a certain amount of issues on other levels. I'll give you an example. I have a 93-year-old mother-in-law, and she said to me 2 months ago, I'm not interested in being confined in my home. I'm not interested in it living if that's the life. This is somebody who's totally independent. She said, I'm old enough to take a risk. I understand social distancing. I'm going to function. Otherwise, there's no reason to live. And so this sort of bizarre, maybe well-intentioned, but misguided idea that we're going to eliminate all risk from life. We're going to stop people from taking any risk that they are well aware of. We're going to close down businesses. We're going to stop schools. These are inappropriate and destructive policies. And I think we have to always remember that. We don't shut down society because there's a massive cost to that. And I'm not talking about financial. I'm talking about lives lost, years of life lost, destructive policies. Okay, there are risks. We know that, but we have to function. And I think most people understand that.
You are at the Hoover Institute in Stanford, which is a kind of right-leaning organization. You advised Mitt Romney, and obviously you're now advising President Trump. There's a political aspect to this, isn't there? That people who are of a more libertarian viewpoint, who put a greater emphasis on individual freedom, will tend to support your view, while people who think that collective action is a more effective response to this kind of thing will tend to support greater restrictions. Do you see this as a political question?
I see that there is a different philosophy in life. In my own family, we have different views on certain things. But I think we have to start by looking at the facts and the data. And one thing that's been sort of really shocking to me is, in the U.S. and I think all over the world, we have a really contaminated media. Their politics has really distorted truth, and that used to be something that I was proud of in the U.S. as an American, that the truth will come out because the media was aggressive at finding the truth. I think that's changed, and it's undeniable that there's a tremendous amount of bias in the media. And this is leading into your question. I think that has now contaminated public policy and science. There's been a massive distortion, a complete almost disregard for objectivity in certain places, including some of what were the world's best journals like Lancet, New England Journal, Nature, Science. I mean, these people feel compelled to be politically visible. And, I just think that's contaminated the discussion. And a lot of the papers that have been published have been what I call garbage in my limited vocabulary, because when you look at the real methods section of these papers, they've been really poorly done, yet they are given the imprimatur of these journals. Now, the politics of discussion here, as I sort of am circuitously getting to, really comes down to, first and foremost, what is the data, okay? And that data has been ignored. There are people that started out in March, April, saying, okay, we need to lock down, we need to stop asymptomatic cases from spreading, this is how we're going to go about doing things. And then when we know that now there are 7 million registered cases in the US, but even the CDC says it's probably tenfold that, that's 70 million at least. We look at the world's cases, maybe 40 million cases, but we know that it's probably 10 to 20 times that. And so that's it's not possible to start doing things like contact tracing and isolating asymptomatic people. And we also have learned the harms, the enormous harms of doing that kind of policy. So that's part of the data. Okay, so the data really isn't just what does the fatality rate, and by the way, we know the fatality rate for people under 70 is 0.05 rather than 3.4 or tenfold or something like that. All these things are learned. We know so much more about this now. We have to get a grip on what we're doing here. And it's not a political philosophy, it's reality. A lot of these people who have what I call very fancy CVs have engaged in very sloppy thinking. And now, because I believe partly because it's a political year in the United States, which a massively polarized electorate, the politics has entered the scene, and there's a tremendous amount of sort of digging in to the original beliefs, even though they're completely wrong. It's been proven wrong what was suggested. There's an adherence to this, partly from the politics, part because whatever. Listen, when I came into the administration, my position here is not political, zero politics. My motivation was the President of the United States asked me, a healthcare policy person who understands medical science, to help in the biggest healthcare crisis in the century. And there'd be something wrong with you if you would say no to that, no matter what your politics. My position is not political. My position is looking at the data, figuring out the right policy. And so when I did that, though, I knew I would be vilified because in the United States, there's a lot of people who think that this president is radioactive. And so there is a massive destruction that ensues immediately when you associate with this president. And that's just a very sad statement on America. It's a very sad statement on American culture. It's a very sad statement on the world because I see it in the international news too, of course. These people are blinded people. I'm saying, scientists, many of whom are blinded to the data because they despise the political side of this and they're digging in. And they have a massive, I just want to finish it. They have a massive ego. And these people can't admit they're wrong. And so when they're challenged, and I'm a contrarian. I'm used to being a contrarian. I'm proud of being a contrarian. I'm proud of being an outlier when the in-liars are wrong. And so I have no problem with it. I'm talking about the data here. I have zero political motivation to come here and do this. In fact, it's to my own personal detriment to be here. But that doesn't matter because I'm trying to help the country.
Are you angry? You sound a little bit angry about the attitude.
I've gone through various levels of being angry. I'm not angry. I'm sort of disgusted and dismayed at the state of things. I have a massive amount of support. It's just sad to me. It's more that I'm cynical about the state we are in right now and the future. And it's not sure it's angry as much as disturbed. And I have children of my own who are in their 20s. And I just wonder what the future is if we have lost truth in the media to a great extent, and we have now starting to lose truth in science. I mean, I don't know what kind of a future that holds for people that are young.
In less than, 3 weeks, we have a presidential election. If the polls are even half right, President Trump will be out of office. What's the prognosis? I mean, if Joe Biden becomes president, what do you think happens as regards the coronavirus policy?
That's a good question. I've heard proclamations like sort of listen to the science. I mean, that's one of the biggest, misconceptions about the president, that he doesn't listen to the science. We have, as you know, 9,000 medical scientists and epidemiologists just sort of aligned very closely with this protected, vulnerable and open society policy, this so-called Great Barrington Declaration, which is the gist of their policy. Thousands of scientists agree with the president, and the president has always listened to the scientists. But the other side somehow says, listen to the science, if we'll maybe consider another lockdown and mandatory universal masks. That's their policy. I think it's very sad. It's completely contrary to the science. It's fear-mongering, and it shows a lack of insight into what's gone on over the past 7-8 months. So I fear for the country if that is the policy direction here. The country should not be locking down. It cannot be locking down. And things like universal mask wearing, honestly, I mean, that is just completely contrary to the science as well as common sense, to think that you must wear a mask when you're in the middle of a desert, when you're in your car alone driving, when you're bicycling through, St. James Park, This kind of stuff is nonsense.
Would you not mandate masks anywhere?
Absolutely not widespread mask mandates. You can look at LA County in Los Angeles here, Miami-Dade County, many states in the US, the Philippines, Spain, France, the UK, all over the world. Mandating masks for the population does not stop cases. That is just super naive, wrong, and just that's garbage science, really, and there is no science to support that. And the WHO does not recommend widespread mandatory masks. The NIH does not recommend that. The CDC data itself shows that doesn't work. So that's sort of bordering on wearing a copper bracelet, as far as I'm concerned. I do think that masks have a role, and that's in medicine. We wear masks for surgical procedures. And the reason you wear a mask is when you're very close to somebody or a sterile environment like an open incision, you want to stop a cough. You want to stop droplet from getting in and infecting something, but that's very different from breathing around a piece of cloth or even a medical mask. There's no evidence that if you're socially distanced, there's no reason to wear a mask. If you're in a subway, I'm just thinking practically here. If you're in a subway, you're in the tube in London, and you're a high-risk person, okay, I'd be afraid. I probably wouldn't even go into the subway if I were a high-risk person in London. But I would use a mask for close proximity to somebody who might cough on me or who I might cough onto. Yeah, so I think there's a reasonable policy about masks, but widespread universal masks, that is pseudoscience.
It may all be over for you, at least in this chapter, in a few weeks' time. You then return to a university campus that is somewhat treating you like a bit of a pariah. There were big letters being written by your fellow academics against what you were saying in public. What's life going to be like for you wandering down the street of Stanford in late November if the president loses?
Yeah, that's a good question. I think people, again, they exposed themselves for who they were when they wrote that letter. I didn't like the letter. It's embarrassing to them. I mean, it's preposterous what was said. And I have a massive amount of support from many of the world's top scientists and epidemiologists. By the way, I've been working with them for 6, 7, 8 months. It's not, it's ludicrous to think otherwise. But in any event, I have a lot of support inside Hoover Institution. I've had a lot of support from the faculty. It's ironic that I work with the 2 top and maybe the 3 top medical science, infectious disease doctors at the School of Medicine. They didn't sign that letter. A bunch of people who were not experts signed the letter. So that's sort of separate. I certainly have lost some friends. There's no question about that. Would I do it all over again? Absolutely. This is the most important thing I've ever done. You're not in academic, health policy to write papers. You're there to have impact on public policy. And the president and I feel the country needed good people because if the good people don't step up, then who's left? And so
it almost sounds like a political slogan there. I mean, have you got a taste for it? Do you think there's potentially a political career for Scott Atlas in the future?
Oh, I have a taste for it, but unfortunately, it's a bad taste. I'm not going to do anything in politics. I'm disgusted by politics, completely disgusted, and I'm saddened by. It's a sad statement on the people. I feel that people were exposed when someone came into power that they didn't agree with. They were exposed for who they were, and that's a gross embarrassment. It's sad. So, I never thought I would think that there are more rational places in the world to live than the United States, because I'm proud to be an American. I'm proud of people who are independent thinkers. But a lot of that has changed. I think that there's a lot of groupthink going on. It's a tremendous amount of emotion rather than, rational thought. And it's been harmful. So I don't know what my future holds, but I absolutely do not.
Is that a hint that you would leave the country?
I always do a lot of traveling as an invited speaker. Before this part of my life, I was an invited professor, in many places. And I think the world is the world is big. I don't know what I'll do. I love certain parts of my life in the U.S. But I'm also, I'm sort of sad about certain things in the U.S., how they've evolved, and we'll see. I'm not going to run for office, though. I can tell you that.
Fair enough. Well, it sounds like you might not be rushing back to Stanford to spend all your time there in any case. We shall see what happens in the next few weeks. Dr. Atlas, thanks for talking to us.
Okay, thanks for having me.
That was Dr. Scott Atlas, advisor to President Trump and a member of the coronavirus task force, talking about his view on the pandemic and what a responsible policy would look like. We shall see what happens in the next few weeks. Thanks for tuning in. This was Lockdown TV.